good afternoon, everyone. And first of all, I would like to thank the organizers for the opportunity to present our work here. There are very preliminary results, but for us, they are so promising. And it's about a new selective HDAC6 inhibitor that ameliorates the disease phenotype in a GDAP1 knockout mouse model. So in our lab, we have been investigating GDAP1-related Charcot-Marie Tooth for more than 20 years. It's an axonal neuropathy with autosomal recessive and dominant forms. And it presents a high phenotypic heterogeneity. And in fact, recessive pathogenic variants that are associated with a loss of function of GDAP1 causes a severe phenotype, whereas dominant pathogenic variants that are more associated to a gain of function of GDAP1 present a mild phenotype. So in all these years, we have been trying to decipher the pathophysiology underlying the disease. More specifically, where are the cellular and molecular processes where GDAP1 participates. GDAP1 is an outer mitochondrial membrane protein that participates in the mitochondrial dynamics, not only in the mitochondrial fission processes, but also in the mitochondrial transport along the axon. It also participates in bioenergetics, in the ATP production, also in calcium signaling, and more recently we have discovered that GDAP1 is a principal protein of the membrane contact sites, not only in the contacts between mitochondria and the plasmatic membrane or the endoplasmic reticulum, but also with peroxisomes and lysosomes. So in the last years, now we are searching for new therapies. And in this case, we use our GDAP1 knockout mouse model that recapitulates the symptoms of the disease. As you may know, and Cleopas explained very well before, axonal transport defects are a hallmark of CMT, impairing the delivery of mitochondrial and essential cargoes to distal axons. So the inhibition of HDAC6 restores the tubulin acetylation, stabilizes microtubules, and improves this axonal transport. There are selective HDAC6 inhibitors that show a strong therapeutic potential, promoting neuroprotection and functional recovery in CMT. As you can see in these images, this is the characterization of our GDAP1 knockout mouse model, and we observe that there is a significant decrease in alpha-tubulin acetylation in both sensitive and also in motor neurons axons. So now we are working with a new family of HDAC6 inhibitors from Chimatrix company, that is a Spanish company, that choose a different group from the hydroxamic as a scintillating group. Plus, they choose groups that reduce lipophilicity in the rest of the molecular structure. So they obtain 182 candidate compounds that then they filter with the nanomolar activity, also the selectivity for HDAC6. They perform pharmacological and biological evaluation, and they choose the compounds with the highest activity for alpha-tubulin acetylation. And they obtain two compounds, the QTX166 and the QTX153. These compounds did not inhibit the CIP cytochrome, so not to be expected to interfere with the metabolism of other drugs. Also present an adequate solubility, moderate to excellent microsomal stability, plasma protein binding was less than 99%. Also, and most important, they present a good blood-brain barrier permeability, very high bioavailability, and none of these compounds show to be mutagenic. So with all of these characteristics, this new family of oral non-hydroxamic HDAC6 selective inhibitors show that reach the brain in high enough amount to inhibit the action of HDAC6 and to be able to perform its therapeutic activity. So we choose QTX153 as a good therapeutic candidate, and we use as a backup molecule the QTX166. And for these experiments, we use two different approaches. The first one is to treat the animals before the onset of CMT disease or CMT symptoms, that is the pre-symptomatic treatment or the preventive treatment. And then we have another approximation that is to treat the animals after the onset of CMT symptoms. And why these two approaches? Because in the past, we treat these animals with two different molecules, with an antibiotic, the florfenicol, and also with an antioxidant, the mitoQ, and we only observe a therapeutic effect when we treat the animals before the onset of CMT symptoms. So we want to test these new HDAC6 inhibitors again in these two approximations. So let's start with the pre-symptomatic treatment. Here I show you the hind limb test, and in the images you can see the males before the treatment. I can point. Before the treatment and after the vehicle treatment or the QTX treatment, and with the females. And we measure two things. First of all, the angle, but also we analyze the severity score that, as you can see in this table, recapitulates or takes into account different parameters in the animals. And as you can see here, in both treated males and females, no reduction in the limb angle was observed, which is consistent with the lack of increase in the severity score. We also analyzed the hanging test, and we again observe in males and females treated with this QTX inhibitor that no reduction in hanging test duration was observed, although the treatment effect was more evident in females. We also performed the rota-rod test, and in this case, we measure the maximal distance that the animals walk in the rod. And in this case, in males, we didn't observe any significant differences. But in females, in two different velocities, the treated mice outperformed controls. So this effect disappeared at higher speeds. In the case of post-symptomatic treatment, here I show you also, again, the hind limb test, the males and the females, and we, again, analyze the angle and the severity score. And in both treated males and females, no reduction in limb angle was observed. And in males, it even increased, though remaining with non-pathological levels. Moreover, the severity score did not rise, remaining comparable to pretreatment values. Here I show you the hanging test, and in this case, in both treated males and females, no reduction in hanging test duration was observed. And we also analyzed the rota-rod test, also again the maximal distance. And again, in the males, no significant differences. But in females, with two different velocities, the treated mice cover greater distances than the vehicle controls, though no global effect was detected. So with all these results, we can conclude that the QTX-153 treatment was effective in the same test under both preventive and therapeutic conditions, a finding of clinical relevance. Although no clear effect is observed in the rota-rod motor test, treatment contributes to at least stabilize the disease and prevents further progression, and the therapeutic effect was more pronounced in females than in males. So altogether, these preliminary results demonstrate that QTX-153 exerts therapeutic effects even in symptomatic animals, aligning more closely with real-world clinical scenarios and supporting further development of HDAC6 target therapies for GDAP1-related CMT. So our next steps, first of all, is increase the number of animals, of course, and maybe increase the dose. We are working with a dose of 60 milligrams per kilo, and in the toxicity studies, they use 160 milligrams per kilo, so we have like a gap. Also, we are performing now pathology studies. We are studying the sciatic nerve and spinal cord, the cellular phenotypes that we know that happen in this mouse model. So we are studying the peripheral nerve inflammation, also the node of Ranvier structure, organelles along the axon, mitochondrial lysosomes and peroxisomes, and also the neuromuscular junctions. And we are also working with microfluidic devices for study the axonal transport and also the neuromuscular junctions. And thank you for your attention.
Yes, we have time for questions. You see the same effect in the pre-treatment and in the treatment. Okay.
Yes, and in the same test.
Okay. Do you have any explanation why the females are answering better than the males? No.
No, but
Because
yeah,
for example, myelin-related problems sometimes are related to hormonal levels.
Yeah, we think so.
Mm-hmm. Vincent?
So there are now currently many HDAC inhibitors being tested, and do you have an idea which one has the best effect in the mouse models now so far?
Sorry?
Do you know which one has the best effect in the mouse models? So several mouse models have been used so far.
We only use this QTX153. We didn't test yet the QTX166. That is the other one that we want to try.
And the TSA you also didn't test. So trichostatin A, no. The other inhibitors, no. Okay.
No.
Yeah.
Yeah. Do you think, thanks for the talk, very interesting. Do you think that GDAP1 minus mice model is a good model for a GDAP1 mutation or a point mutation which has a dominant effect?
Our GDAP1 mouse model?
Yes.
Yeah. Yeah, it recapitulates the symptoms of the disease in the case of recessive variants of GDAP1 that are associated with a loss of function, not for dominant variants.
Yes, but yes, it's usually dominant, so that's my problem. Is it really a reliable model, the minus?
Yeah.
Pavel?
Because GDAP CMT is in human very severe or can be very severe. But have you seen or tested, I don't know if I have missed that, some electrophysiological improvement in the...
No,
or
we didn't test
some
with
evidence
these inhibitors,
this is
no.
only this is functional.
Yeah, it's something that we want to do. Yeah.
Because they are
yeah.